Hello, my channel family. I'm Getvas from Addis University, ጥቁር አንበሳ Specialized Hospital. In today's pharmacology tip, we will see the overviews of drug for management of blood disorder, or we will see especially anticoagulant medication. So first, let's see the common coagulation cascade. This helps us to understand the targets of different medication. So this coagulation cascade is composed of two pathways. These are intrinsic pathway and extrinsic pathway. The intrinsic pathway is the complex one, and the intrinsic pathway is the simplest one. These two pathway come together and forms the common pathway. The common pathway starts from the factor 10. So when you see the intrinsic pathway, when intrinsic pathway starts when platelet activated factor 12. This activated form of factor 12 is responsible for the conversion of factor 11. This activated form of factor 11 is also responsible for the activation of factor 9. So activation of factor 9 and activation form of factor 8 with the help of the extrinsic pathway, it forms the common pathway and it activated factor 10. And also the extrinsic pathway starts when the injured tissue release different tissue factor. This tissue factor responsible for the activation of factor 7, and this factor 7 with the help of intrinsic pathway it forms the common pathway that start from the factor 10. So this factor 10, the activated form from factor 10 is with the help of factor 5. It converts prothrombin to thrombin. So the factor 10, the activated form of factor 10 with the help of factor 5, it converts prothrombin to thrombin. So this thrombin, or the activated forms of factor 2, it converts fibrinogen to fibrin. This fibrin is the final insoluble clot or the final coagulation. So this thrombin or factor 2 it forms fibrinogen to fibrin. So this indicates activated. So and finally this clot is formed. There is a chemical that can degrade this clot, that's known as plasmin. This plasmin is an endogenous chemical that cuts the insoluble fiber and sustains the hemostasis of blood. So this plasminogen is converted to plasmin by using tissue plasminogen activator. This tissue plasminogen activator is responsible for the conversion of plasminogen to plasmin. This plasmin is the active form and cuts fibrin clot. This tissue plasminogen activator, like that of urokinase, that activate the plasminogen. So when you see the different medications that target in different place, first let's see the heparin. Heparin is the anticoagulant medication. Its target is antithrombin 3. Antithrombin 3 is an endogenous chemical that normally inhibit the different factors, like that so factor 2, factor 10, and also factor 9. Factor 2, factor 10 and factor 9. So when heparin binds to the antithrombin, it increases the activity by 3000 fold. So by increasing its inhibition, it helps us for anticoagulant purpose. So heparin, we have two types of heparin: high molecular weight heparin and low molecular weight heparin. From low molecular weight heparin, we can mention enoxaparin, deltaparin, and tinzaparin, and also the high molecular weight heparin. This high molecular weight heparin is responsible for the formation of heparin-induced thrombocytopenia. These are the adverse effect of high molecular weight heparin. And protamine sulfate is the antidote for high molecular weight heparin. And also the other medication is the factor 10 inhibitor. This factor 10 inhibitor, these drugs are known as we have different medications that inhibit factor 10. These drugs are rivaroxaban, apixaban, vindoxaban, and betrixaban. This different medication inhibit factor 10 and finally reduce the formation of clot. The other medication is warfarin. The structure of warfarin is like that of vitamin K. So this warfarin is the competitive inhibitors of vitamin K, and warfarin inhibits the enzyme known as vitamin K epoxide reductase. And it's guys, vitamin K is essential for the formation of different coagulation different factors like that of factor 7 and 9 and 10 and also factor 2. So this warfarin is competitively antagonist vitamin K. By blocking the enzyme vitamin K epoxide reductase, it reduces the vitamin K level and reduce this tissue factor, and also this tissue factor is responsible for the formation of clot. So the other medication we will see is factor 2 inhibitor, thus factor 2 direct factor 2 inhibitor. These are bivalirudin, algatorba, dabigatran, and also hydrogen. So these are factor 2 inhibitor, direct factor 2 inhibitor, bivalirudin, algatorba, and dabigatran. Dabigatran is has in the oral form. So this dabigatran takes as PO form. And also this bivalirudin algatorban is have IV form. So this bivalirudin and algatorban that are administered in the IV forms. This factor 2 direct thrombin inhibitor, direct factor 2 inhibitor, or thrombin inhibitor, which are called bivalirudin, algatorban, and dabigatran. Let's see the antidote for direct factor 10 inhibitor. So the antidote for rivaroxaban, apixaban, indoxaban, and betrixaban is known as andexant alpha. This is a medication that overcome the toxicity of the factor 10 active factor 10 inhibitor, rivaroxaban, apixaban, betrixaban, and indoxaban. And also for the antagonist of warfarin, we administer vitamin K, as vitamin K is the competitive inhibitor for warfarin, and warfarin and vitamin K is similar in structure. So vitamin K is antidote for warfarin. So the other medication we will see is tissue plasminogen activator. Tissue plasminogen activator. We have different medications that activate this pathway, and when this pathway is activated, the degradation of clot is increased. So we have a medication that activates the plasminogen conversion to plasmin. So this medication like that of urokinase, alteplase, and streptokinase, urokinase, alteplase, and streptokinase, a plasminogen activator. By activating the plasminogen, it forms plasmin. This plasmin is responsible for clotting, and also this helps us for anticoagulant purpose. The other groups of drug is coagulant drug or fibrinolytic inhibitor. This fibrinolytic inhibitor is it inhibits the coagulation breakdown cascade. This medication inhibits the coagulation breakdown cascade. So this are aminocarboic acid and tranexamic acid. This medication is the competitive inhibitor for tissue plasminogen activator. This aminocarboic acid and tranexamic acid is a competitive inhibitor for tissue plasminogen activator. By blocking the conversion of plasminogen to plasmin, it reduces the cutting action of plasmin. So this medication aminocarboic acid and tranexamic acid, it inhibits this pathway, and finally it increases the formation of clots. So from this aminocarboic acid and tranexamic acid is responsible for the treatment of hemophilia. So in today's pharmacology tip, we'll see the anticoagulant medication, and we'll see some coagulant medication. From coagulant medication, we will see fibrinolytic inhibitor, aminocarboic acid, and tranexamic acid. This aminocarboic acid and tranexamic acid inhibit the tissue plasminogen activator, and finally, it reduces the levels of plasmin in blood. And also, we have vitamin K. This vitamin K also increase the clot, and it is responsible for the management of hemophilia. And also we have seen different anticoagulant medication from heparin to different factor inhibitors. From heparin we have seen low molecular weight heparin like that of enoxaparin and deltaparin, and high molecular weight heparin. And also we have seen the direct thrombin inhibitor, this direct thrombin inhibitor known as bivalirudin, algatorba, and dabigatran. This dabigatran found in the oral form. And also we have seen the direct factor 10 inhibitor, this factor 10 inhibitor like that of rivaroxaban, apixaban, indoxaban, and betrixaban. We have this factor 10, this position factor that we can remember the factor 10 inhibitor by remembering the structure, rivaropatrixama, endoxama, apixama, metrixama, and also we have seen warfarin. We know warfarin is long-acting anticoagulant. It is a vitamin K competitive inhibitor by inhibiting the enzyme vitamin K reductase inhibitor. Vitamin K epoxide reductase, it inhibits the levels of vitamin K, and vitamin K is responsible for the formation of different factors. Getvas Thank you for watching the video. Please like, subscribe, and follow the channel and support us.